So, welcome to today's podcast. This is me, Nurse Eades, Nursing Made Easy, and we're going to be talking about fundamental tips for nursing students. Again, I'm your host, Nurse Eades, and today we have 10 essential nursing tips that will help guide you as you go through your fundamental course in nursing. So, we're going to get right into it. Some of these are things that nursing students have asked, feedback from our podcast. And so the first thing I thought was tip one. You want to make sure that you're mastering the basics. You have to remember that nursing is built on a strong foundation of fundamental skills. So you want to focus on not only perfecting your assessment, but also looking into mastering how to do your vital sign measurements and then your hygiene techniques. These basics will serve as the backbone of everything that you do in your nursing practice. Being able to look at your patient, assess them, looking at vital signs to add to that assessment, and then making sure that their oral care and other ADLs are taken care of. Those are the things you don't want to find yourself memorizing. As a student, I was told memorization is the key, and I have learned that it is not the only key. It shouldn't be the priority. It should be get your books at the very beginning as soon as you can get them, and then start looking at the fundamental things. Start looking at the nursing assessment, what you're going to be expected to do, and then get an idea of what you don't know, what you have questions about by highlighting it. And then when you do that, when you start school, you have all the questions that you have in mind. You can focus on what you need to pay attention to. And then once that skills lab comes open, then you can utilize your time familiarizing yourself on how to do a head to toe assessment, how to make a bed, how to engage in doing a bed bath, and how to take vital signs. So tip two, develop effective communication. There's a couple of things that you're going to need to do. So I'll stick with the fact that communication is what's going to get you through the nursing program. You have to practice active listening. You also have to be empathetic. You have to make sure that your communication is clear. And then you spread this communication not only with your instructor within the classroom, but then you learn how to communicate with your patients, your families, and your healthcare team. And when you do this, you ensure your safety, the safety of your patient, but you're also guaranteeing that you're putting out quality care. If you start effective communication in your first semester of nursing school, and embrace it and allow yourself to be made over from the way that you talk outside to the way you should be professionally, you will see that your relationship with your instructors, including the relationship that you have with the patient that you build on your clinical time within the facilities, that is going to get better. Okay, tip three, embrace time management. If you have not already heard a couple of guest lectures or guest pods that I've done, it's called The Secret to Surviving Nursing School. It lies here. I've done a couple of those over there. Feel free to go and look at those. But we talk about how to embrace time management, what to do on the first day of nursing school, because it can be demanding. But if you can learn how to manage your time, this is going to be crucial to your success within your program. So you want to make sure that you're creating your schedules, making sure that you're prioritizing, and creating that schedule happens before class starts. So if you can reach out to your instructor and say, I know it's busy, I appreciate everything it is that you're doing, but if I could get an idea of how soon we'll have access to the schedule so I can start planning, that would be really great. If not, and you don't get that response, it's okay. Because on the first day of school, they're going to give you everything it is that you need. And the first thing you do, that first break that you have, or as soon as you get home, you're going to want to be making sure that you're putting everything into that schedule. Then prioritize what you're going to need to do. Prioritize based on when your next exam is going to be. That helps guides how much time you have to study each week, but then what chapters you need to be reading to make sure that you're prepared to cover that material. And remember that laundry list. Create yourself a laundry list of all those things that you don't know so that you can make time to go back and study those things, and then avoid procrastinating. It's inevitable. It's within us. We wait till the last minute. It's easy. I don't want to get up in the morning because I just want to sleep a little bit longer. Or wait, yes, I can go out and eat because it's really not due until tomorrow, and it only takes me 4 hours. And then by the time you get home, you only have 2 hours left. So don't find yourself procrastinating, because it will eventually catch up to you. Make sure you're balancing your time effectively to help reduce the stress and improving your academic performance. The biggest thing that I can say is if you're not prepared the first day of the class, it automatically assume that you're going to be about a week behind if you don't take that day to catch up. So if you look and you see that you have a books, and most courses, most programs, nursing programs, it is a requirement that you have a book attached with your course. So make sure that you're reaching out, getting a book, getting a used copy to give yourself a heads up. Find someone who's been in the program who may have books that um, they want to pass on to you. But again, I want you to stick with your curriculum, making sure you're sticking with what your assigned book is, but then getting an idea of what the schedule might be in advance to get that heads up. And so when you show up, you're showing up with your textbook, you're showing up with your writing tablet to take your notes, you're showing up with your devices so that you can record if it's allowed within your course, to do audio recordings. And then if not, using your tablets to actually jot down those notes. I have found, and I'm pulling up my phone, notables. Notability, I think is what it's called. I think it's Notability. That is a great resource for pulling up my PowerPoints and writing right on top of that, so I can keep up my notes with what's being said in the class. Okay, so what is our next tip? Our next tip, someone asked, was about cultivating critical thinking as a nurse. And season 1, I think it's episode 5, talks a little bit more about that. But as you continue on in your program, you need to understand that you're taking knowledge based questions. So now it's not just what you learned in class. How do you apply these in complex situations on a daily basis? So help develop that critical thinking skill by making sure you're analyzing the information, considering what those alternatives may be to the care that you might provide or any interventions, and then use that information to make a well-informed decision. And it's really critical thinking and judgment is really at the heart of the nursing practice. It's about what you do with that information. So get yourself in the habit of starting to look through that process. I'm looking at the information, and then current textbooks have updated themselves to the new NCSBN 6 clues of looking through information to recognize what those cues are, analyzing, forming a hypothesis. Um, there's 3 other ones. I think they are about taking action, evaluating the outcomes, and I'm forgetting the one in the middle. But make sure that you reach out to that, and I probably will do a podcast on it. So if you can catch that one on the next. Alrighty, so we're moving on. Another tip that has been very instrumental to me and others is practicing self-care. Um, Nursing school in itself is a whole different program than any other program you will ever be a part of. It requires a lot of self-sacrificing, and requires a lot of support, whether you are already working in the medical field or if you've had no experience in medicine. It is a lot to have to embrace. But if you are willing to give up and forsake all others for the sake of nursing during the time that you are in nursing school and put it first, I can promise you it'll be worth it. I'm still catching up on Grey's Anatomy from way back when, because I decided I can't keep up with television. I couldn't keep up with those things. When my friends were hanging out, I cannot be with you right now. Yes, I want to go. I want to hang out. I want to do these things with you, but I need you to be supportive of me. And that is going to be really important is self-care first by making a good support system. Unfortunately, not all the time does our loved ones, our close friends and families, they remember the path that we chose to take. And so sometimes they forget and they're not available to give us the support that we need. And so then we have to start caring for ourselves emotionally and physically. So make sure you prioritize. Yes, it is okay to take a break. And I'm going to say this, what I learned as a nursing student was I can't be all nursing. And although I did make it all nursing, I want to say that I planned the time. So I knew how much time I had. I can go out for 1 hour, and after 1 hour, if anybody wants to go out with me, I'm going to be here. I'm going to do this, or 2 hours, and I'm going to go out and do this. I'm going to do that. And when I'm done, I got to leave. It was great hanging out with you guys. I'll see you later. I have to study. And I made sure that I was like, I'm not going to drink. I just made sure that I took care of myself. I made sure that I gave myself that time with friends and family when it was appropriate to make sure that I was avoiding any burnout. And then I made sure that I got enough rest. Yeah, I want to hang out until 11, 12 o'clock, 1 o'clock at night, but I can't do that anymore. I got to get rest. Eating healthy. I forgot to do that. And every time I came to class, I would have this lightheaded and dizziness or so afraid of being sick before taking an exam that I wouldn't eat the night before and I wouldn't eat that morning. And I paid for it because I was lightheaded and dizzy while taking the exam. And if you're lightheaded and dizzy while you're taking the exam, you're not answering the questions correctly, period. So make sure that you eat healthy. If there's a hobby that you can do that's not time consuming or can be done in little bits, engage in that. And then remind your friends and family that you still need their support and tell them the ways in which they can be of assistance to you. Tip 6, be adaptable. The field that you're choosing to go in is constantly evolving, so you have to be flexible. So if you have to be flexible in nursing, if you're choosing to be a nurse, you have to be flexible in nursing school. Being willing to embrace changes, be open to new learning opportunities, and then making sure that you're staying update with evidence-based practice is going to be important. The reason why I talk about that flexibility is this. Your instructor is always going to have something that says, hey, okay, this information is subject to change. Everything is not always going to go the way we expect them to. But if we take energy away to insist upon having our own way, we're no longer spending that time on studying. If you're willing to be flexible and go, there must be a reason, even if I don't understand it, you will be more adaptable to change. So what I have encouraged students to do is when you're in that moment where you're overwhelmed because maybe there's an imbalance in that self-care, okay? And you're trying to figure it out and you're overwhelmed. You want to speak it into existence. Think about whether or not what you're getting ready to say, how you're getting ready to say it, would be something that you would say to your patient. Would it be something that you would say to your boss? If it's not something that you would say to your patient or something that you would say to your boss, then kind of hold it back. Find another way to say it. And then ask yourself, are you tired? Are you overwhelmed? Get assistance with that first. And then when you seek assistance for problems pertaining to the course, you'll be in a better situation to do so. But if you're more flexible about it, majority of the time, if you go with the flow, you're less likely to be bothered by the fact that nursing changes, nursing school changes, courses change, and you'll be more adaptable to just flow with it. Tip 7 is about patient safety. So when you're learning in fundamentals, look at why this is important to your patient and what role does safety have to play in it. Remember, always following protocol, double check medications that you're going to be giving, reading labels, advocating for your patients. Know the 9, 10, 11 rights. It's usually 5 or 6, but we've added on to it since then. And then create a safe environment to to maintain a high quality of care for that patient. The biggest thing that I will say is always follow protocol. If you're not flexible within your nursing program and willing to follow the protocols, you're less likely to follow the protocols when you're a nurse. You'll begin to question it. You'll begin to make your own rules. You begin to do things your own way. And when you start doing that, you stop following protocol and you could put your patient at risk. So think about that. All right, collaborate effectively is tip 8. You are currently in a nursing program, you're a nursing student. You have to collaborate with your team, whether it be your classmates or whether it be your professor. This is important because as you become a nurse, you're going to have to learn how to collaborate with other healthcare professionals. But this starts in nursing school. If you haven't done it before, to have to work with someone else, to have to respect the ideas of other individuals, to respect the expertise of others, but then to also contribute your own knowledge for the best outcome of the patient. If you don't learn that while you're in nursing school, you won't form that habit, or you'll get out of the habit of doing it. And again, it's about patient safety. So it's not just what I'm thinking. Usually there's a bigger reason for why we do things. And if we respect the process, then we will ultimately provide safety for our patients. Tip 9, seek feedback and learn from mistakes. In your nursing program, the best place for you to make the mistakes is in a skills lab. If you don't have access to your skills lab the way you should, advocate for yourself. Get access to that skills lab. And if you have unlimited use, every waking moment, make that your living room, your skills lab. Find a desk, sit down, look at your videos, look at your skills check off list, perfect it, and then go and take it. The next thing that you'll have is tip 10, which is making sure that you're embracing the nursing code of ethics. Make sure that you're guided by that. Uphold patient confidentiality, treat all individuals with respect and dignity, and make sure that you maintain the highest level of professionalism throughout your nursing program. Well, there it is, your 10 fundamental nursing tips. Remember that you're on a journey through nursing school, and this is just the beginning. It's going to be incredible, and it really is going to be rewarding. Make sure that you stay dedicated, keep learning, and always put your patient's well being first. Thank you for tuning in, and we'll catch you on the next episode.